provide educational services, we give therapies, and we do behavioral and learning support. Myself and the team, Miss Nicola, occupational therapist, and Ms. Ghada, speech therapist, and Ms. Sousan, she's a behavioral therapist. We'll let you know more about a very important topic, which has to do with the early intervention, a subject that I believe every parent should know about it and to anticipate when they need help when it comes to their kids' development, learning, and different milestones. As a parent, to be honest, when I bumped into such titles and occupations, occupational therapist, speech therapy, behavioral therapist, I was like, what are these? Like, when am I gonna use them in my life? Am I gonna really need such services? And therefore, I would love to ask the therapist to let us know more about the role and how they support kids from different milestone and different age group. Nicola, if you can tell me what is an occupational therapist?
Yes, of course. So occupational therapists work in many different sectors, but occupational therapists, sometimes it's known as OT, when working with children, our main aim is to support them to meet their developmental milestones. So we focus a lot on gross motor skills, which are like big movements, fine motor skills, their sensory integration skills, play skills, and also we support with like attention and concentration also. So basically anything that's inhibiting a child from interacting with their like daily life and their in different environments, in school and at home.
Correct. So the way the child behaves on different environment is something important and makes it maybe more important to help the child to gain some kind of talents or different activities to be actually melt onto the same age group.
Yeah, so exactly. So if a child is having any difficulty with within school or in their development, an occupational therapist can assess and determine if the child has a specific difficulty in like a core skill area.
Correct. So is that something global or
sometimes
very specific?
Sometimes it can be like a global developmental delay, or sometimes it may be just a specific like motor difficulty, or sometimes if during our assessment we may notice that, actually is it possibly a vision difficulty. So within our assessment, it's designed to be able to determine what skill area or what core area is impacting on the child's performance, and then we can target that skill area with intervention.
This is somehow makes me believe that a parent should at least know what to expect from their kids at different age group.
Yes.
And maybe Sousan can jump into this discussion and let us know what are the skills or at least the behavioral skills that I can expect from my child on different age group.
Well, I actually was mentioning to my colleagues earlier that the CDC and the American Academy for Pediatrics, the first time in 20 years, they amended the milestones. They added a cognitive and social component for every age group. I printed it so that in case someone has questions about, let's say, a specific age group. But what we always do is I don't know if you guys agree with me, but we try and look at the whole picture. We try and see, as Nicola said, what are the barriers that are stopping the child from showing what a typical child their age would show. So for instance, at 2 years old, we expect a child to be able to make two-word phrases. But it might not be the case, and we don't immediately jump into the conclusion that they have a speech delay and freak parents out. But we also don't want to, it's a very Arab thing when we say, it'll come, and a village raises a child and all of that approach. So it has to be a balance between both ends of the spectrum. So
sometimes that's right. Like the village really can raise a child, especially when it comes to the speech.
Yeah.
Maybe Ghada can tell us about it more. For example, we noticed a lot of speech delay. We noticed a lot of speech delay to kids, but however, they pick up at some point, and we wonder why this child, he didn't say even one word, but suddenly he's saying a phrase, like instead of saying even one word, but now he's he can even see a paragraph. How would that happen?
Sometimes it can be already the lack of the environment that affect the speech for him. If he change from that environment, it can be a family, it can be the school, it can be also a lack of confidential. He's not confident to, he can talk or he can tell, maybe he will make it a mistake, maybe he will not talk correctly, so that it make the child go back, make like isolation for himself, to do, he will choose to don't speak. But if you change him from that environment, or you push him, you give him the confidence, he will grow up, he will make that the big step, the jump, big step to start to talk really.
If, for example, my child show a delay for a reason, as Ms. Ghada just said, maybe the environment did not induce his language and he doesn't have language, like terminologies, you know. But when you do the assessment, how could you get the right assessment? Because sometimes, like, I'm sorry, I don't want to scare any mothers here. Sometimes you can get incorrect assessments and immediately give a title for a child. Oh, your child is autistic, and something not every mother would love to hear, you know. If you got a case like this, who should we believe, Ghada or you? Like Ghada, she's promising maybe he have a delay of environmental exposure. But what about occupational therapists?
It's definitely very difficult for parents right now. I think, as you say, they may go and they get different opinions. But when it comes to a diagnosis, it's very important for parents to know that that needs to come from a doctor or a clinical psychologist regarding a neurodevelopmental disorder. So I would really advise parents that if they are bringing their child to get, for an assessment, that they're bringing their child to a specialist. So of course, all doctors can diagnose autism. However, you would be best going to someone who specializes in neurodevelopmental disorders. Also, I think, as you mentioned about, I'm sure parents may be a little bit fearful about getting a label or a diagnosis. So it's very important for parents to know that they can go and have an initial consultation. So for example, at Mrabet, we offer initial consultation. So within OT, we'd offer initial consultation whereby the parent can come and get advice, and then we may recommend, yes, maybe it's a good idea to go get a more formal assessment, or we might say, let's start some intervention and see how the child progresses, or we may just give the parent advice to go home, work on things like some specific activities for a few months, and then come back to us. And I think this is something that we've all probably seen in recent months, is that with COVID, there's been so much delay with children. So
especially with exposure of screens.
Yes, and we've had some kids come into us and quite delayed, but then once we've put in some intervention, they've all completely surprised us with. So it really does make us feel that the COVID did perhaps broaden a gap that maybe was there, but thankfully with support, the gap can close again.
I wouldn't say necessarily the reliance on screens like the iPads, PlayStations, or all of these ways of passing time is necessarily the cause of why there's this delay that we see. I mean, iPads are the best babysitter. I really think everyone can agree about that. But it can be very educational as well, especially if the parent sits with the child and they talk about what they are playing with or what they are watching. However,
if it's used wisely.
Exactly.
And under control of the family.
Yeah, exactly. So they sit together and it's more of a interactive. Yeah. But what I think was the cause of the widening of the gap, I mean, there would have already been a small gap between this student and his peers, but then they come back from the isolation and being limited in the type of activities they do every day, because even physical activity will actually help all of that neuron work fire in the brain. So yeah, I mean, I started calling them pandemic babies, some of them, because I'm like, oh, I understand the syndrome now. Even my own nephew, like, he forgot how to make friends because between the age of 2 and 3.5, he was at home. Yeah, so that really exacerbated an already existing problem, perhaps. But I really like what you said and what you brought up, when we have different specialists giving different diagnoses or conflicting diagnoses. We always have to sit down at the end and talk to the parents and see what do they feel is the most firm diagnosis. We have to look at who is really the specialized person to make a diagnosis, not just a screening. And finally, at the end of the day, regardless of the diagnosis, what we have to look at are the deficits and the excesses. What do we want to increase in terms of skill level, and what do we want to get rid of or decrease in terms of some behavior they show? So in Nicola's case, for instance, she wants to see more senses in sync, or she wants to see more gross motor coordination. In ABA, in behavior analysis, we want to see people or children being able to inhibit some of their difficult behavior. We want to see them cope or play nicely. So I think that's what we end up focusing on, giving parents the intervention and guiding them to focus on what can be do rather than the name or the label.
I would not love it to label my child. I feel like it's kind non-ethical to label the child, but I know at the time you should live with it. But if you can tell me more about it, like, maybe I'm very sensitive about it.
No,
and
I think I completely understand where parents are coming from. As you say, no one really wants to give their child a label, and I think it's about how you look at it. It doesn't change your child.
Correct.
The idea of the diagnosis is about getting your child the right intervention.
Yes.
For most professions, and I was going to speak for all of us, as in, we don't necessarily, it's not a case where, okay, your child has this diagnosis, let's take out this, therapy plan.
Correct.
We look at each child individually, and that's how it should be done.
And it's not necessary that you have the same diagnosis and you have the same plan.
No, not at all.
Okay.
Yes.
Exactly.
Correct.
Yes.
You're putting a child into some mold.
Yeah.
But yeah, she's right. We look at each individual child.
And just going back to the assessment, again, what I advise parents to do is the kind of gold standard, if you are going to go for a diagnostic or a formal assessment, is to have it multidisciplinary. So, for example, you may have a psychologist, a speech therapist, and an occupational therapist, all assessing your child.
A comprehensive kind of diagnosis. And we do
assessment,
that in Maharat Center.
Yes, and then we all come together, sit down, discuss our thoughts, and that way we can make sure that we're not missing something.
Correct. And the result will be a very thorough report.
Yes, and you will have it.
It's not just a sentence.
No,
right?
it is. It's a big report. But at least then you will feel a lot more confident in knowing that your child has been fully assessed. But as you had said also, you don't necessarily have to come and get a diagnosis. You can get help and support without a diagnosis.
But let me ask you this. If I got a diagnosis as early as 2 years old and I got like a very big report, there is a percentage that the information inside the report will change on a different age group?
Yes, so
I'm just saying, maybe the diagnosis will miss the right diagnosis at a period of time. Please say yes.
Yeah. So what can happen is children can always, like, as in the whole idea is that they're going to improve and become so right. The level of support, so for example with a diagnosis like autism spectrum disorder, there are 3 different levels, so level 1, level 2 and level 3. They do not equate to how severe the autism is. It equates to the level of support the child needs. So what we tend to see is a child may start off at level 2 or level 3, which means they need like higher amounts of intervention and support. But if that is given early, they can then move up to that they do not need that much support in their daily life. So a level 1 would mean that they may need some educational support here and there, maybe some social like for support with social interaction, but daily life they're very independent children.
Yeah, you're absolutely right. And I believe that the support that the child gets from their home, from their parents, is significant. It's very important, especially to the speech.
Yeah.
I remember when I was the first time mommy, I used to talk to my child when he's only 1 day old, only 1 day. And as I keep talking to my child and everyone around me, oh, he is just a baby, like he doesn't understand you. You're wasting time. It's like, no, he understands me. And look, he even stopped crying when he hears my voice. He knows who am I. It's like, yeah, nonsense, you know. And believe it or not, my kids, they speak very early if I compare them among the family kids. Yes, comparison is not that good. However, the early interaction with the child plays a vital role.
Yeah, because from his fetus, from his in the mother's belly, he already start to feel.
Correct.
What are you feeling? He
Yeah.
can hear you. So from the age of 1 day, he can feel.
Correct.
Maybe he's not understanding, but he can feel. He can see what.
He can sense what's
Yeah,
happening.
yeah, that's very important to start from the first days, first months. That it will help him when he
Okay.
grow up.
What kind of a support that a mother can do in order to keep the child within the expected skills on different milestones?
The things that you can do to help yourself. Of course, you can read and so on, but there are some apps, even apps developed by the CDC that help you track. The CDC, the Center for Disease Control in the US, but also the the American Academy of Pediatrics, they have an app. So it tells you, and there's also, I forgot.
It's a free app.
Yeah. There's
So
also a
anyone can
baby
download
center.
it.
Yeah. Anyone can download it, and it can tell you, like, by now your son or daughter should be able to do this with you. And then your pediatrician needs to always be open and honest and not sort of skip over basic checkups.
But also the parents has to be very consistent when it comes to the
Taking them to the, yeah. But there are, I mean, I really love that you brought up the idea of speaking to your son or daughter. I mean, there's so much research that shows they recognize a smiling face from a pouty face, from a inanimate objects, from even when they barely can see you. So it really does make a difference when you're smiling at your son or daughter and you're speaking in a certain tone. It's very, very important to educate yourself on these little things. So I really think you're having good instincts already. Yeah, of course, I do. But I want to mention something, and I know it's a little odd to hear. I have seen many parents feel relieved when they finally know what is wrong with their son and daughter. To be honest, I really have seen that a lot, because they keep saying they're not like their siblings. They aren't the same as other kids. I don't know what's wrong. Please help me.
You know the problem, you can prepare them with cure.
Yeah, but what we try to tell parents is that you don't have to have a diagnosis to get the intervention. It just helps you get there in a clearer way. Clinicians can speak more precisely with each other with it, but it's not necessary. In fact, in our department, we, as you said, in our center, we first do a consult, and then we either encourage parents to go investigate further, or we just start with a plan. You know.
Yeah, that's fair enough. Again, Nicola, how do you deal with a parent who does not accept the diagnosis? Because working with parents for the past 5 years, I saw different parents, to be honest. Some of them are very open and very willing to help their child and very willing to hear even from the therapist. And some of them are, let's say, they really doesn't want to face the fact. Does that make a difference?
I think it's about, from a clinician's perspective, to be understanding when you are discussing a diagnosis, and making sure that the parent really understands that it's still their child.
Correct.
Nothing has actually changed. And rather than focusing on the diagnosis, focus on skills.
Correct.
Focus on. So it's really about, as I said, focusing on skills.
Correct.
Like, yes, the diagnosis is important, but ensuring that parents understand that we are now focusing on what the child can do, and what can we now work on next, and make their child as independent as possible.
Maybe we kept mentioning the word skills, but can we know what skills from your point of view, and maybe we'll ask Ghada and Sousan to tell us what should I expect on the first 1 year, on the second year, and third year?
I think this is something as well that we spoke about. So One thing I would advise parents as well is that if they notice that their child is not interested in a specific area or even like a specific area of toys,
Yeah.
often in an initial consultation,
Yeah.
I will ask the parents, what do they normally do? What do they normally play with?
Yeah. Yeah.
And sometimes when I hear that a child is not playing with toys
Correct.
that are normally targeted to their
Yeah.
age group, this could may be a sign that there are deficits in
Correct.
skill areas. So
But isn't it okay if a child, like for example, I don't want Lego,
yes,
I don't like Lego.
yes, which is okay.
Yeah.
However, you might notice a pattern then.
Okay.
So for example, they don't like Lego, but they may not like puzzles also. So then this might tell us that, okay, there might be a visual perceptual difficulties or
Correct.
fine motor difficulties. And the issues, and I know it's absolutely fine, as in not all children have to play with every
Correct.
toy, but when we do not take this time of playing and interacting with these type of toys, the deficit can then become larger,
Correct.
right? And they might fall further behind.
So the earlier we jump into the picture, the better.
Yes, and it
Okay.
can be the case where you might encourage when a child doesn't want to play with something, just keep note of it and then see if you can see a pattern. And if there's a pattern forming, then try to encourage your child to, even for 10, 15 minutes, and see, is it that they're able to do it and just do not want to do it, or are they actually having difficulty doing it?
Before you discover a pattern, there's a difference between they're not able to do it and so they get frustrated and don't even approach it, and or they know how to do it, they just are very disinterested in it, and they might the constructive play like Legos or blocks or puzzles. Yeah, there's a pattern certainly, but it can also be that they just simply flat out don't like it, but at least they know how to do it. So yeah, I think it does make a difference to note these things, and then if you do have a consult to bring these things up, I think it makes a big difference.
I always feel that there is a conflict between a therapist and a mother. And sometimes I feel like the therapist will make a decision on the center that is different than a decision that she can make in her home with her kids. For example, like at a certain age or on a specialized, let's say, kind of a situation, I would allow a child to defend himself and show a kind of an impulsive behavior for just treating a certain behavior within the child. But if you come and you ask a therapist, it's no, beating is not allowed at all. He should not do this at all. But this is somehow confusion between ethics and non-ethics, mother and therapist, and maybe that's between me and you and the audience and Mom's World Live people. It's just us. We're gonna keep it very confidential, very confidential. So, honestly speaking, Nicola, have you ever faced such a situation where you felt there is difference or different decision between you as a therapist in a center and you as a mother at home? Very honest.
Yes, I think
The reason why I really stress on that, because sometimes we do something that we did not even learn it by the book, but your intellectual and your emotions force you to do it.
Yeah, and I think that really comes down to like personality and role as well, and environment.
Yeah.
So for
The
and
culture,
as
yeah,
well. Yeah.
absolutely.
Yeah.
So yeah, I think if there is ever that case where I know, say, this is my advice, but often I will say to parents, I know it's hard to do. I know myself, it's difficult to do it, and it's a lot easier to say. And I think once the parents know that you are coming from that place as well, as in, this is my recommendation, this is my advice, I understand that it's not the easiest thing to implement, then I think they're a little bit more open to actually trying it, because they know you're not coming from a place that you have to do this, you need to do
And that
this.
you're hearing them.
Yes, yeah.
Like you're hearing their concerns and you do understand it, but you still have the same opinion. I think I'll come back to the defending ourselves, teaching our kids to defend themselves. I have been coming across this thing when it comes to the sexual development of our children. We always have debates in the middle of a parent meeting. It ends up being a back and forth, and then they say, but you're Arab, you should know that this is wrong in our culture. And then I try to tell them, but it's the mechanics of something. And so at the end of the day, it is the family's choice in some things. All I can do is educate, show the research, tell them what I think. I might go home and do something with my child, but it is ethically, I'm ethically compelled to share what is evidence-based, what is recommended globally by people in this field. But about, like, we always talk about if our child is being bullied or what do we tell our child to do? I know technically and on paper, I should say no hitting and everything like that, but I would want my child to be able to defend themselves.
I'm very proud that you said this, because too many people that I met, even in the center, they keep saying, oh, therapists, they give us solutions. That is only for the books.
Yeah, I do. I could see that. Sometimes we do. We get preoccupied with all the work and.
I'm very glad that you guys open for the idea.
Yeah,
and
we have to.
Makes us like being very real.
Yes.
We are not books. We are not ideas laid down there and
Yeah.
research.
Yeah, I mean, and I really sometimes have to stop. I'm not even a mom yet, but I have to stop and think, like, even my own nieces and nephews, what would I do if I see one of them being attacked in a playground? I would, of course, my instinct is to tell them, at least block it or push them off of you and then go find help, not turn your cheek.
Use the
But-
correct way.
Yeah.
Use the correct way how to defend.
Yeah, and then we teach them some assertiveness skills to get themselves out of a situation to begin with. When they see a precursor of, like, some people are going to threaten them, we teach them ways to escape it and go figure out how to deal with it. But of course, if my child is physically being bullied, of course, I know it's by textbook, I shouldn't be saying this, but I wouldn't want my child to just take
That's
it.
something normal.
Yeah,
It's normal.
Yeah.
Like the desire within a human being is to defend himself, and that's why the life has continued to this moment. You know, we survived. Yeah. Okay, and I think we came to the end of this session, and from my point of view, I would love each one of you to give a final advice about the importance of early intervention. So maybe we can start with Nicola. Take a break.
I think with early intervention, like, all the research is there to say that the child will have the best outcomes with early intervention. So I would say, as in, you've got nothing to lose by coming forward earlier, because all you're going to do is get information, and it might be the case, as I said before, that we may say, look, go home, work on X, Y, and Z, and if the child is still having difficulty, then come back. So I would just really say to parents that the earlier you find out, as in get more information about where your child is developmentally, the sooner you can start working on whatever your child needs. So yeah.
I would like to say it's never too early or never too late to start the therapy.
I love that.
Whenever you find that the development milestone of your child is not going with their age, please go to the pediatrician, start to check, ask your friend. Yeah, do anything, don't stay in your, no. Many now parents, they like, it's okay, as you said before, he will talk, he will improve. His sister is like that, his nephews is like that. But please, whenever you find there is some problem, there is some delay, try to contact any therapist, try to contact any doctor, anything, check. It can be also medical problem, it can be hearing problem. So try to check, don't wait, don't waste the time. The time of the child is very, very important. We can say the one day, it's in the future, it's like 1 month, 1 year for him.
Absolutely.
Yeah. So I prefer to tell any mother or any parents, please follow with your child, check his development.
I love what you said. It's never too early and it's never too late. And yes, there are some cases where issues resolve themselves. We've seen it happen firsthand. But it doesn't mean you can't go ask for resources, at least, right? You can say, I'm not open to have a diagnosis or therapy, but I do want to get your opinion on what's happening. And it is hard to hear, even if you have to go to a counselor yourself to deal with it. Your child cannot be the one to pay for it, for the delay. And then what I find the hardest to deal with is when I see parents shopping from doctor to doctor or center to center until they hear what they want to hear. I get it intellectually. I understand why they're doing this. But as she said, each day in the life of a small child is like a month or a year in our age. So definitely don't be obsessive and paranoid, but it doesn't mean you should put your head in the sand and wait for things to resolve themselves.
It's not important. The diagnosis is not important. However, blending the child and give him the right skills that blends him within the same age group, it's what we are really looking for. And we at Muharat Learning Center, we are willing to help any child and parents with any behavioral learning or even developmental issues. We really enjoyed our time with you here, and Sousan, thank you. Thanks a lot for coming here. Though we work today on Muharat, and I'm sure that all the therapists just worked out their schedule to be able to come here. Thank you, everyone, and we hope we added to your information.